Okay, we're going to do the external surface of this Saunders heart model. We're going to be taking a look at some of the surface vessels, and we particularly want to pay a lot of attention to the great vessels that are coming up off the base. We are also going to turn the position of this model and look at the back side or the posterior side to look at some of these structures too. So just to orient ourselves, remember we've got the 4 chambers, and you're looking at the external surface, of course. So up here you've got the right atrium, but you're looking at the right auricle that covers it. Here's the right ventricle, left auricle that's covering the left atrium, and then here you've got the left ventricle. So remember that when you're looking at the heart, it's always the patient's right and left and not your right and left when you're looking at it. Okay, so when you're looking at the major vessels coming off of the heart, remember that you have the coronary arteries that are going to service the heart muscle itself. So the right coronary artery is going to come down this indentation or sulcus. You're going to have the left coronary artery coming down this indentation, also known as a sulcus. And then remember that the left coronary artery splits. The part that comes straight down here through the interventricular sulcus is called the anterior interventricular artery. But the branch that comes off to the left and goes around to the back side of the heart is called the circumflex artery. You're also seeing the great cardiac vein coming down, a major vein, and that will wrap around to the other side of the heart. But let's take a look at the great vessels that are once again coming off the base of the heart, and we'll turn this around so you can see their extensions as well. I always tell people that if you put your hand on the surface of the heart, the first large vessel that you're going to hit is the pulmonary trunk. You can also call the pulmonary trunk the pulmonary artery. That eventually would branch into the right and left pulmonary arteries going to the lungs, but that's been cut off on this model. So this is just the pulmonary artery or pulmonary trunk, okay? Follow the arrows. The arrows are helpful here. So that happens to be a vessel that's carrying blood away from the heart to the lungs. Now you're going to count over toward the right. You're going to have 3 main vessels. So we have the pulmonary trunk. The next one over is the aorta, the largest blood vessel in the body. And then count 1 more over and you're at the superior vena cava. Okay? So let's start back here. Pulmonary trunk, once again, is cut off on this model, so you're not seeing its branches. Let's go to the next one, the aorta. There are 3 major branches that are going to come off of it, and you can see those indicated by the red arrows, okay? Now, what's centering us, you'd have the person's head up here. This is your breathing tube, the trachea. So you want to look to the right side. This would be the right side of the neck, and then the left side, which would be the left side of the neck, of course. So let's hit the right side first. There's 1 branch coming off of the aorta, and remember you first had the ascending aorta, but now you're at the aortic arch where these major branches are coming off. And the first branch, which goes to the right side of your neck, is the brachiocephalic artery. Brachiocephalic artery is going to branch into 2 major branches, and the one that goes up your neck is the right common carotid artery. The one that goes off toward your right shoulder is the right subclavian artery. Okay, let's keep going on the aortic arch and go to the second major branch. This comes up to the left side of the neck. This is the left common carotid artery. The third major branch coming off of the aortic arch is going to go toward your left shoulder, and that is the left subclavian artery. All right, we will turn the model around in just a little bit to look at the descending aorta, but let's come over here to our superior vena cava. And so that is returning blood to the right atrium, but it is fed by 2 major veins. The vein that is off to your right side is the right brachiocephalic vein, and the vein that is coming from the left side is the left brachiocephalic vein. Okay, now they are fed by other veins here, so I'm going to back up here on the left brachiocephalic vein. It is fed here by the left subclavian vein coming from the left shoulder, and you also have a jugular vein coming from the left side of the neck. Over here on the right side, we have the right subclavian vein. It is being fed by the right subclavian or sorry, that's the right brachiocephalic vein. I can't remember if I said brachiocephalic or subclavian. That is brachiocephalic vein. It's being fed by the right subclavian vein coming from the right shoulder. And then you've got a jugular vein here that is also feeding into that. Okay, we're going to flip the model around now and take a look at this side. Hopefully you can still see that. So the largest vessel that you're seeing here, this is the back side of the aorta. This is the descending aorta. It does cut off here, but this would go through the thoracic cavity and it would pass through the diaphragm and it would go down into the abdomen to become the abdominal aorta. So this is a very long vessel. So you can see its branches here. And I wanted you to see on the back side the pulmonary veins. Okay, so the pulmonary veins are bringing blood. There are two on the left side of the heart here and two on the right side of the heart. These are returning blood back to the left atrium, the upper left chamber, and they're coming from the lungs. So these two that are on the left side are coming from the left lung, and these two that are on the right side are coming from the right lung. So it's good to see those. And I think that's all you need to know on this model. Besides the blood vessels, I just want to orient you and make sure you know what you're looking at here. This peach tube that's back here, this is the esophagus. That's a digestion tube. So you are carrying food and drink from your throat down toward your stomach so that it can be digested, of course. And that is posterior to the trachea. So you're able to see these cartilage rings through. So you're seeing the posterior side of the trachea and the esophagus is right behind it. Just so you kind of know, where all of these things are connecting and how everything is situated. So here's the anterior side of the trachea. The esophagus is right behind it. All right.